I started Artist Social Inquiry in 2008, and by 2012, I had no idea that I'd be carrying portraits to Washington, D.C. to stand in front of the Supreme Court and U.S. Capitol buildings. I was studying how policies play out in real lives, and I was using art to do it. I was telling stories about access to health care, mostly war, violence, death, all the big ones. And I found myself drawn into access to health care as my main focus. And what I was discovering was truly alarming. Unless people were getting their health insurance through their jobs, many were uninsured and underinsured, which means they didn't have enough insurance coverage to cover a catastrophic event. I found that people buying insurance on their own were discriminated against for having a pre-existing condition. Insurance companies could just deny a person insurance coverage for having had acne. Acne was a pre-existing condition. We were really headed off a cliff when it came to access to healthcare for this large country of 320 million people. And I had been telling stories since 2008, and I was standing in the kitchen. It was the fall, and I was listening to the news, and I heard that the Supreme Court was taking on the challenge to the Affordable Care Act, and I was disturbed. By this time, word of my project had spread, word of mouth, and people would just tell me their stories. They were happy to at least have somebody listen to them. I heard stories about people losing their life savings. One man went medically bankrupt. He had premature twins in the 1980s, and he thought he was adequately insured. He was underinsured. His policy had a lifetime cap, which means after a certain amount of payout, the insurance company would pay no more. He lost everything, even his marriage, house, rental property. The sheriff showed up at their house at 7 a.m. to escort them out of their home. I heard stories about people losing loved ones, people dying because they couldn't access health care. Truly disturbing. They had nowhere to turn, all because of health insurance. The Affordable Care Act, I discovered, helped a lot of people gain insurance, about 20 million, and with politics being what it was, especially in 2012, there was such resistance and, frankly, propaganda about what the law was and was not, that the fixes that the law needed never happened. So I'm standing in my kitchen in the fall of 2011, and I get the news. The United States Supreme Court will decide whether or not the Affordable Care Act is constitutional, which means they could strike the law down, but they did not in the end. Back in my kitchen in 2011, I am mad. I know from interviewing all these people that striking down the Affordable Care Act would mean so much more suffering. It's unacceptable. There is nothing like anger to fire action, but I'm mad in a good way, and I just throw down the kitchen towel and say, I have had enough. I've had enough of the bankruptcies and the stories and the pain and the deaths and the stress, the quiet desperation that the country lived under, and continues to live under for different reasons regarding health insurance. I decide right then and there that I'm taking these portraits to the Supreme Court, and I'm standing out in front of the Supreme Court, and I want to show the justices who these people are and what they suffer under the system, our healthcare system. And lo and behold, the United States Capitol is across the street, and when the Supreme Court was not in session, I took the portraits across the street, and I would stand for 5 hours a day, 3 hours in the morning and 2 hours in the afternoon, with a break for lunch at Union Station. I have to thank the Quakers. I called the Quakers, the Friends in Philadelphia, and asked them how I could get lodging to do this bearing witness. And the Quakers are all over it. So they hooked me up with the Quakers in D.C. By the afternoon that day in the kitchen, I had secured a basement apartment for trade. I would do some house cleaning, and also my husband, a chef, would do some cooking, and I would drop it off in the fridge upstairs. I would haul my portrait of the day down to the Capitol and the Supreme Court, and I would stand. And I learned a lot. I stood 2 to 3 days a week for 5 months. I knew the gesture was symbolic. However, it was powerful. I did put my finger on the pulse of America, and people thanked me for standing, people who suffered, and I was grateful. And I was grateful for those who opposed the Affordable Care Act and engaged me. It made me stronger and better and clearer and more determined than ever. It showed me that I was basing my actions on good information. I cut my standing short by a month because I felt that I had circled the issue, the experience of being there. I left saddened because I realized that very few people had very good information about the new healthcare law, and that people didn't understand what their fellow citizens were going through, and they weren't interested, that somehow some political fervor had taken over people's minds, and they were against just for the idea of being against, not based on real information. Yeah, there were a couple of exceptions where some people would come and discuss policy. I knew I was putting myself out there. I was standing for so many days, for so many months, that I would just at night hole up and just read and read and read and read and study. But by the end, I learned that most people opposing the Affordable Care Act were just repeating what they heard on Fox News. And that made me sad as an American, that people weren't using their own critical thinking. And I realized that logic would not prevail and good information at that point would not prevail. But since I am heartened to say that people have had the experience with the healthcare law and it polls more in favor than against. Although it needs some fixes and some shoring up, I hope we can look forward to that happening. But for the most part, the consumer protections in the healthcare law kicked off a reform movement that I think will continue for many years to come. And that's how I ended up in Washington, D.C.